Welcome to the 2021 SGIM annual meeting. While I wish that I were speaking with you in person, this video message will have to do for now. Thank you so much for joining the 2021 annual meeting. I'm really excited about the program and I look forward to learning together with you. As I consider this past year, during which it really has been my true pleasure and honor to serve as SGIM president, my first thought is that I can't believe that it's already been a year. It was exactly a year ago when I was working with your program chairs, Drs. Rita Lee and Yael Shanker, around identifying the meeting theme for this year, transforming values into action. Little did I know the extent to which our meeting theme would actually characterize our past year as an organization. Now, having assumed the SGIM presidency just as the COVID pandemic was gathering steam, and given that this past year has really been a bit of a blur for most of us, it's actually been helpful to reflect on what we together have achieved over this past year. And despite the multiple distractions of the COVID-19 pandemic, this really has overall been a positive year for SGIM. So much has been accomplished. And as I noted in my April forum column, this was all possible because of the fabulous foundational work that Dr. Corby Smith did during her presidency, really clarifying our goals and our strategies. And then Dr. DeSalvo's leadership, which focused us on the social determinants of health. And the combination of those two and the strong foundation that was built during those two presidency years, as well as the exceptional SGIM staff, as well as all of the volunteer member engagement and leadership, and really the commitment of all of you has really made it so that SGIM has had a truly remarkable year. And I am very confident that SGIM has continued to advance its 4 organizational goals and strategic priorities that were set forth during Dr. Corby Smith's presidency, as well as have risen to the challenge issued around social determinants of health during Dr. DeSalvo's presidency. I'd like to take a bit of time to highlight some of these key accomplishments over the past year. And this is really a sampling, and we will be posting on the website a summary of the year, but just to highlight a few things. One of the key things that SGIM has focused on over the last year has been really amplifying SGIM's voice through advocacy and as well as through some strategic relationships. And some of those examples are an initiative that we participated in along with the American College of Physicians, the American Academy of Family Physicians, the American Academy of Pediatrics, the American Board of Internal Medicine, and the American Board of Family Medicine, and the American Board of Pediatrics that developed a unified vision for fundamental reform in primary care financing. This statement is available on the newprimarycareparadigm.org website, and I encourage you to take a look at that. SGIM also is a sponsor of a very soon forthcoming National Academy of Sciences, Engineering, and Medicine study on implementing high-quality primary care. And we did have 4 SGIM members that were serving on this study committee. We expect to see the report very soon. It's due to come out in early May, and we're very much looking forward to seeing that report. We also continue our strong relationship with the Society of Hospital Medicine, and particularly around the Academic Hospitalist Academy. And this past year has been busier than ever on the health policy front, with the Health Policy Committee, as well as other SGIM committees and commissions responding to multiple requests for comments and letters. And I think, if I counted correctly, that between March of 2020 and March of 2021, SGIM advocacy efforts resulted in more than 50 such letters. And I encourage you to check these out on the SGIM website. And a huge thank you to those of you that brought issues to our attention, as well as those of you that took the careful time and thought to work on these responses and letters and position pieces. In addition, SGIM issued 6 new position statements and policy papers. These are also available on the SGIM website. These range from the most recent one, which was just posted, which is on reproductive rights. We've had a number of policy statements around racism in medical education, around racial injustice, and internist role in the social determinants of health. So something else I encourage you to check out on the SGIM website. And midway through the year, SGIM actually tasked the council, that is, charged a task force with developing recommendations for how we as an organization could more effectively address diversity, equity, and inclusion in the way that we function as an organization. And I'm excited about those results, and they're just being finalized now. But one of the key messages is that our need to integrate diversity, equity, inclusion across all of our activities as an organization, and all of the committees and commissions in this new year's annual planning will be including components of DEI in their plans for this next year. One of our additional big initiatives this year has been around philanthropy and our Funding Our Future campaign. Now, this really has its roots pre-pandemic, where SGIM committed to expanding its sources of revenue to support innovative programs and initiatives, and identifying philanthropy as a key component of this process. Given the significant negative financial impact of the pandemic on the organization, particularly with the loss of the 2020 annual meeting revenue, it really made the philanthropic campaign even more essential. SGIM thus launched the Forging Our Future campaign, as well as a new philanthropy committee in summer of 2020, setting out an ambitious goal of raising $200,000 in 2020. And I'm really pleased to share with you that we exceeded that goal by over $50,000, which included 100% participation by members of council. So thank you, council members, to rising to the challenge. We've set an even more ambitious goal for 2021 of raising $300,000. And just some of the ways that we have already used those philanthropic contributions, just so you know, where is this money actually going? We were able to increase scholarships for trainees, including increasing the number of fellows that received a scholarship to cover membership, as well as increasing the number of students and residents that were able to receive a scholarship to cover registration to the 2021 annual meeting. So hello and welcome to all of the trainees who were able to benefit from those scholarships. We've also used the donations to cover the cost of a new learning management system that will provide us with a great platform for sharing the excellent content, offering scholarship, offering CME and MOC, as well as potential ways to generate revenue for SGIM. We're also using some of the philanthropic donations to cover a platform to support our mentoring activities, the SGIM Mentor Match, which some of you may be taking advantage of at this annual meeting, as well as using donations to cover the cost of the virtual platform on which we're hosting this annual meeting. So thank you to those of you that have donated so far, and thank you in advance to those of you that are planning on donating in the future. In addition, SGIM has continued to have quite a successful run, receiving a record number of submissions this past year. And I want to thank you to our editorial leadership team who has been managing all these submissions, as well as to all of you that are sharing your scholarship through the Journal of General Internal Medicine, as well as all of you out there that have been reviewing for SGIM. So thank you for that. Now, we know that community is so important to our members, and for many of us, it's a key value that we find out of our SGIM membership. And meetings have been an integral way to foster that community. And one of the ways that that's been maintained over this past year has been through the regions, and particularly through the regional meetings. And I've had the good fortune of attending several regional meetings this year, and was just so impressed by the quality of the content, as well as the camaraderie and connections that were fostered even in that virtual environment. So regional leaders, great job in fostering this over this past year. So I end my president year with really deep gratitude to the SGIM staff, to the member volunteer leadership really at all levels, and to each of you for keeping us moving forward in our mission of cultivating innovative leaders and cultivating educators, researchers, and clinicians in academic general internal medicine, and really leading the way to better health for everyone. And I just know every one of you is a leader. And with your engagement, we will achieve our shared vision of a just culture of care in which all people can achieve optimal health. I'd like to close by recognizing the leadership of Drs. Rita Lee and Yael Shanker, who said yes when I asked if they would be the chair and co-chair, respectively, of the annual meeting committee, and also the entire program committee, for your really steadfast leadership and creativity in planning this fully virtual annual meeting. The content looks just terrific, and I think you all are in for a treat. So enjoy the meeting, and I look forward to seeing you in person next year.